Hello, I'm Carol Celine, and this is Jefferson Close-Up. My guest is Dr. Daniel Quirk. Welcome.
Thank you.
Now, when you were growing up, you did a lot of the usual sports. You did skiing and hockey and basketball and track, but you also did shot put and discus, which are not so common. What attracted you to those things?
I think exactly that. First, they weren't very common, and I wanted to do track, but I wasn't a very good runner, so I had a better body habitus for the weights, and it worked out much better, and I really enjoyed it.
Now, what's your favorite way to spend time?
Obviously, I'm blessed with 4 young children, and spending as much time with my wife and my kids as I can when I'm not at work is great. They all love to ski and play tennis, and it's a great outlet. Yeah.
You're a gastroenterologist, so you treat, I assume, patients who have all kinds of stomach disorders, but do you have a particular interest in anything special?
Probably the bulk of any gastroenterology practice has to do right now with colorectal cancer screening, and that keeps everyone very busy, and that's an important part of my practice. I have a particular interest in Barrett's esophagus. I think Barrett's esophagus is very interesting on a number of levels. First and foremost, it's a precursor to esophageal cancer. It's a very common problem. We can see it as much as 12% of people that have reflux disease. But of that 12% of people that may have Barrett's esophagus, only a very small percentage will go on and develop esophageal cancer. So our challenge is to find those patients that are most likely to progress and then intervene.
What are the symptoms that usually bring people to your office?
Well, if it's heartburn-related disease, it's typically that. It's people complain of classic heartburn, regurgitation, maybe they have difficulty swallowing, or unexplained chest discomfort. They've seen their cardiologist and they've had a negative workup, and then they get sent to us for further evaluation. Oftentimes people are sent here and they don't know why they're sent. They're sent by their primary care doctor because they have abnormal laboratory studies, and they want us to help evaluate that.
You also do endoscopic ultrasound. What exactly is that?
Endoscopic ultrasound is a tool where the tip of the endoscope actually has an ultrasound probe on it. So in essence, it allows us to do an ultrasound from the inside of the body. And as we spoke about earlier with Barrett's esophagus, when we do find someone that has an early cancer of the esophagus, we'll often do endoscopic ultrasound in conjunction with that evaluation to make sure that we don't see lymphadenopathy outside of the esophagus, which would then suggest that it's a more advanced tumor, and in which case those patients would be treated with surgery and chemotherapy and radiation as opposed to an endoscopic treatment.
Yeah, fascinating. What are some words that people who know you well would use to describe you?
Most of which I probably can't repeat, but the ones that are probably germane. Patients have been very kind over the years. I received a lot of letters and feedback. And I think that the thing that seems to run true is that people are appreciative of the fact that I listen to them, and I tend to be thorough.
Well, those are important qualities for a doctor. Thanks for being with us, Dr. Quirk.
Great, thank you.